Now, in our homes, there are usually many seniors and elderly people. For them, back pain tends to occur frequently. Now, according to research, if someone is over 60 years old, there is a very high chance, about 60%, that they will experience back pain. This mainly happens due to aging, spine arthritis, and weak muscles. In this video, I'm going to share tips on how elderly persons can avoid back pain. So, let's get into the video. So, importantly, there are 6 important tips to avoid back pain. So, first, if you look at the elderly, older people, they should keep moving and have gentle exercises. So, mainly because of reduced movement, when they sit in the same place for a long time and don't have much movement or activities, that's why this pain occurs. So, there are 3 important points for this. The first one is walking. In your daily routine, you should try to improve your walking for about 15 to 30 minutes. So, this will help increase circulation to the spine and all the joints. So, now if you look at the second one, it's swimming and water therapy. That is, in many apartments, there are swimming pools, right? There will be a swimming pool center somewhere nearby. So, when elderly people, senior citizens, do swimming, the strain in all the joints like the knee joints, elbows, shoulders will be reduced a bit. By working out in that way, the back muscles will improve well. Thirdly, if you see, there are seated exercises. For those who can't do all these, there are some exercises that can be done while sitting on a chair. I will explain that in detail in my next video. So if you do these kinds of points just 3 times a week, you can easily avoid about 30% of back pain and joint pain. Now, the second tip or point is improving your sitting and sleeping posture. As people get older, they tend to sit for long periods, sleep for long hours, and spend a lot of time lying down. So if we maintain the correct posture, we can avoid these long-term pains. So first, if you look at sitting tips, always sit on a chair with good back support, with proper lumbar support, and make sure to lean back comfortably. And while sitting, your feet should be touching the floor and avoid slouching too much. Secondly, let's look at some sleeping tips. So when you're lying down, you can sleep normally, facing up, looking at the ceiling, or you can sleep on your sides. Sleeping on your stomach should be avoided as much as possible because this puts a lot of strain on your spine muscles. Secondly, many people ask whether it's better to sleep on the floor or on a mattress. A firm mattress is always the best choice. It shouldn't be too soft either, and it shouldn't be too hard. It's better to avoid sleeping directly on the floor. And while lying down, you should place the pillow in the correct neck alignment. I've already made a video about the sleeping posture, so you can watch that to learn more. What can people with knee pain or sciatica do? You can place a small pillow under your knee and lie down. By doing this, the strain on the leg will be reduced and the stretch on the sciatic nerve will also decrease. If you look at it, people who sleep in the wrong posture often wake up in the morning with much more pain. For those people, just adjusting their sleeping posture a bit will give them good relief. The third tip is strengthening your core muscles. As you get older, strengthening your core muscles, abdominal muscles, and back muscles does become difficult. But if you follow these 3 simple exercises, it will become easier. The first one is the pelvic tilt. Lie down on your back, bend your knees, keep your feet flat on the floor, and then gently lift your pelvis upward. Hold for a few seconds and then slowly lower it back down. Repeat this movement several times. This exercise is also known as bridges. If you look at the second exercise, chair sit to stand, it's a very simple exercise. While you're sitting on a chair of good height, you can slowly stand up and then sit back down again. You can do this about 5-10 times without using your hands for support. By doing this, your legs and your thighs will get a bit stronger. If you look at the third one, this is also very simple. Seated march. So now, while sitting, lift each knee up like you're marching. By lifting your knees up and down like this, your strength will increase and you can avoid hip and back strain. If you do this daily for 5 to 10 minutes, you'll see a lot of effect. Tip number 4 is hot and cold therapy. So when people experience pain, many of them use ice packs or hot packs, but they don't know when and for what they should use them. First, when it comes to the cold pack, let's say you have some pain. If you wake up in the morning with back pain or joint pain, you should use a cold pack first. You can do this within 48 hours of the onset of pain. So this will help reduce both the swelling and the inflammation. Second, let's look at the hot pack. If the pain has persisted for more than 48 hours, which is equivalent to over 2 full days, utilizing this method will significantly aid in the deep relaxation of your muscles and simultaneously promote a substantial increase in vital blood flow throughout the affected areas. Furthermore, as you continue with your recovery, if you opt to take a soothing hot shower or perhaps indulge in a comforting bath with generously warm water, ensuring thorough and complete bathing. So tip number 5 is maintain a healthy weight. As you age, maintaining that weight becomes very difficult and losing weight is even harder. Healthy habits for weight control are important. First, let's look at this. A balanced diet. Otherwise, you may develop bone weakness. So include a diet rich in calcium and vitamin D such as milk, spinach, and milk products that are high in vitamin D. spend some time walking in the sunlight. If you do this, your vitamin D and calcium levels will increase. Secondly, by improving your intake of fiber-rich foods like greens, vegetables, and such, your back pain will be reduced. Constipation will also decrease a bit. Third, you need to drink plenty of water. So, because of this, your spine, discs, and joints will all get rehydrated and become more flexible. So, here's a fact for people who have this kind of pain, even if you reduce your body weight by just 5%, you will get significant relief from this pain. So, if you look at this final tip, it's a very important one. When to see a doctor. Many people have been suffering from pain for a long time. They don't even know when they should see a doctor. So, whenever this pain is persistent, getting worse, or affecting your normal activities, you should definitely go see a doctor. So, most importantly, you need to watch out for these 4 signs. Mainly, if the pain lasts for more than 3 weeks, see a doctor. So, if we can diagnose and identify any problem in elderly people a little early, we can prevent it from turning into a serious complication. So, just because elderly people get back pain, it doesn't mean that it has to be there or that we have to just tolerate it. Even small lifestyle changes like these can bring you significant improvement. Your activity and mobility will increase over the years. So if you like this video, please like, share and subscribe, and also forward it to your friends. So stay healthy, age healthy, and see you in the next video. Thank you.